When people talk about GLP-1 results, they usually mean one thing, weight loss. But in real life, results are way more complicated than that. Some people lose a lot of weight, some don't. Some struggle with side effects, some lose quite a bit of muscle. And some realize that the scale doesn't tell the whole story. So if you're wondering whether you should be on these drugs or you're already on them, it helps to think beyond the headlines. I'm Dr. Vivian Lowe, board certified physician in internal medicine and obesity medicine with over 20 years of treating obesity. I'm also the author of a book on the GLP-1 system. And here I break down the science, the real life challenges, and the practical questions people have about GLP-1 medications. Let's go. Okay, so GLP-1s have been in the news quite a bit, and we're always hearing about the wonderful results that we get with those drugs from the drug trials. So in this video, I'm going to show you the real world results, the kind of results that you get when we're looking at people in real life taking those medications and they're not doing a drug trial. So the drug trial results with the GLP-1 drugs like Ozempic, Wegovy, Zepbound, and so forth, we get very good weight loss, 13% to 20%. Now, just so you have some comparison in mind, bariatric surgery weight loss is about 25 to 35%. But, with the medications, you don't have to go through surgery, and those are pretty good numbers, right? What about the real world? Well, again, I put a table here so you can see it clearly. With Wegovy here, 15% optimal. In real life, a little less, 8 to 12%, but still very good. Tirzepatide, otherwise known as Zepbound, you see more weight loss. This is a combination medication. So you have 21 to 22%. But in real life, it's less than that. It's 12 to 15%. Now, I want to emphasize that these numbers are still good, but already you see that real life, there is a big difference because we have real life pressures, we have real life stress, right? And so we're not able to have the same conditions that are available in the drug trials. And so our real life results are going to be quite different. With the weight loss, though, the problem with that is that there is also lean mass loss. So about 30 to 40% of the weight that is lost with these medications and from any kind of weight loss is going to be from lean mass. Just so we're clear, lean mass is basically some of the water in your muscles, the bone, your organs, and muscle mass. When you add that all together, you get this one lump sum called lean mass. Now, whenever you lose weight, you're going to lose a little bit of water. In the short term, you're not really going to lose bone, okay? That we see in years. You're not going to lose organs, hopefully, right? So the main loss here is going to be muscle, and that is going to be the main concern with any weight loss, but particularly with these medications because they're so powerful and we see so much weight loss. Now, when we look at body composition, how much of your body is made of fat, muscle, or bone, a healthy body composition by DEXA, which is a kind of X-ray. So I'm not talking about the body composition scales and those little devices you hold at the gym. I have other videos that talk about it. But in general, using DEXA as the measure, for men, you want the fat to be under 25% of your weight, and you want the muscle component to be 55, in a very buff individual, it might be 60%. For women, you want the fat under 35% and the muscle maybe around 45 to 50%. Okay, that's in healthy body composition. The big problem is that as we age, we're going to start to lose muscle, especially after the age of 40. Now, sometimes people will say, oh, the good news is even as I've aged, my weight hasn't changed very much. Now, think about this. If you lose 5 pounds of muscle, and you gain 5 pounds of fat, when you step on the scale, you're going to see the same number. And that is why weight is so deceiving. We can't go by weight, we can't go by BMI. Really, the optimal thing to do is to get a DEXA scan because we need to know how much of that weight is coming from muscle and how much is coming from your fat. And with the weight loss here, we're concerned that 30 to 40% of the weight you lose is coming from lean mass and you're losing muscle at the same time. So, why are we so concerned about muscle? Because it's really important for health. It's important in preventing frailty. So, as we age, we've seen that in healthy older adults, and they're not sick, they're just generally healthy and living in the community. If they have less muscle mass and they have a condition called sarcopenia, they are 4 times more likely to die from anything than someone else who doesn't have low muscle mass. All right, so it's very important for your health. It's also important for your brain health. The less muscle you have, the less you're able to move, right? The worse your brain health, the more degeneration you have in the brain. And it's also very important for your metabolic health. And this is because muscle is the biggest sink for blood sugar levels, right? So when you eat a meal and the blood glucose rises in your body, 75% of it goes into the muscle, and then any spillover, it's used up or it goes into the fat, let's say. All right. So if you have good muscle mass, then you have a nice pool, a nice reservoir for the glucose to go into. And as you age, as you lose muscle and that reservoir gets smaller and smaller, then you have less of a container for the blood glucose. So now you have a meal. It could be the same meal that you've been having all these years. And one day you find that even though you're eating the same way, that your blood sugar levels are rising. And that's because your muscle mass is shrinking. The container for glucose is shrinking. And so there's more spillover of glucose into the bloodstream, and that's why you will have worsening metabolic health as your muscle mass decreases. So paying attention to muscle with the weight loss is very important. In the studies and in real life, the main concern on the GLP-1 drugs is that yes, you're losing a lot of weight, but you might be losing a fair amount of muscle as well, and that could actually be compromising your health. Okay, now let's look at real world retention results. So in the drug trials, the retention was pretty great. It was about 85%. A lot of people just stayed on the drug. The dropout rates in the real world are higher. So after the first month, and this is the phase where we're just trying to start off the drugs, and we're really not really at the highest dose yet. We're just slowly starting at the lowest dose and trying to work our way up. At that stage, about 30% drop out. By the time we get to 3 months, we have about 50 to 60% of the patients that started still continuing the treatment. At 6 months, it's roughly the same, anywhere in the 50, 60% range. And they're staying on depending on drug availability, insurance, and so forth. But when we get to about a year out, we get 32% to 60% of users remaining on the drug at the 1 year mark. This is very dependent on insurance, different locations and regions in the country and so forth. But it's not as high as the 85% retention rate that we see in the drug trials. What about regain after stopping? I think a lot of people are interested in this. So we find that 1 year after stopping, typically you're going to see people regain about 2/3 of the weight that they lost. Okay, so I just make the numbers easy. If they lost 60 pounds, they'll regain 40 pounds. And the speed of regain is about 1 pound a month. And if we project it out and extrapolate it out, most will probably get back to their pre-treatment baseline weight within 1.5 to 2 years. So I want you to remember that when someone is on the drug trial, that's the best case scenario. And this is because all the drug trials, all of them involve lifestyle modification. It's not just the drug, All right. And sometimes people forget that piece or they don't even think about it and they think, oh, the drug does all the miracles. And that's not true. For the best case results, you have to have some solid lifestyle modification there. And the patients in the trials get intensive coaching, they get nutritional guidance, and there's controlled medical supervision. This is very important because nowadays, sometimes people find ways to get these medications by going to gyms and different online platforms, and somebody just orders the drugs for them. And you don't really have good medical supervision. You don't really have anyone kind of overlooking your health history and helping you manage those drugs as we go along. And with that, your doctor can help you manage the symptoms so that you can tolerate the drugs and stay on them longer and get better results, right? They can titrate it depending on your symptoms. And a lot of times when you kind of try to get it, again, through click medicine, online platforms, and so forth, you're not going to get the same level of care. And so you're actually compromising your results, and you're not going to get the best kind of results for you. So, bearing that in mind, the first thing I want to tell you is if you're trying to self manage and do this on your own, stop. Okay, you need to find a good licensed healthcare professional and doctor to help you manage the medications. All right, do it the right way, don't half ass it. Right. Some of you are on it and you want more help, more guidance on the lifestyle modification and get some intensive coaching. You can start by getting the workbook that I've designed for people who are on the GLP-1s or maybe are even trying to get off these medications. So this workbook includes live Q&A sessions with me so that you can bring your answers about your questions about these medications and about what you should be doing in terms of your nutrition and exercise to help you make sure you get the best results. And if you're interested in that workbook, then you can check the link in the description. I'll see you in the next video.